It's mainly the diagnosis to make clear in which patient what has to be done. And when you're talking about surgery, then of course I have to have a clear indication and knowing what to do, how much of the disease has to be treated surgically or what can be treated with medication. So individualized planning of the surgical procedure when there is an indication for a surgery.
Currently, I think I use principles that I learned from my mentors, like people like David Kennedy, Jim Palmer, Alex Chu, which is first of all to do good, complete sinus surgery, good mucosal preservation, and meticulous post-operative care to make sure that the cavities that we've created remain open. But surgery is really just a way to alter the plumbing, as it were. As we've already talked about, when you have patients with inflammatory disease, I think the best way to optimize outcomes after surgery is educating the patient that surgery is just the first step in the process, making them understand that this is really going to be, at least at this point, a lifelong sort of treatment where they're going to have to be chronically treated to suppress their inflammation. And so I think it's a combination of good technical surgery, but I think the absolute key is to marry that to good patient counseling and good post-operative medical therapies to target the inflammation.
Everyone has persistent inflammation if they have chronic rhinosinusitis. Surgery doesn't take that inflammation away. So what we have to do is to resolve that inflammation with medical therapy, and that requires, for us, it requires endoscopic follow-up. So the patient is typically asymptomatic after the surgery, and the symptoms take a while to develop, so we need to monitor these patients endoscopically over time. And what we do is we use trained mid-level providers to do that. So it's nurse practitioners who do the follow-up once the patients are relatively stable, adjust the medical therapy and make sure that they remain clear, and in fact that the mucosa over time stabilizes, which it does. So it just takes a long time for that inflammation to settle down. Continued medical therapy. I think what's really changed is the use of high-dose, high-volume topical steroid nasal irrigations. That has clearly made the long-term outcomes better than just topical nasal steroid sprays. It's not FDA approved, but we use it very regularly. The other thing that's come along, which I think is important, is the use of implants, steroid-eluting implants after the surgery. So that helps us to settle down that inflammation and takes away the issue of patient compliance, which is always an issue, particularly when the patient's asymptomatic. So we try to follow these patients up, make sure they're complying with their medical therapy, and that the mucosa is slowly stabilizing.